Hi, everybody. It is quite chilly, even for me. Lovely, thank you. Many thanks for the introduction, David, and thank you so much for the invitation to be here with you all this evening. It really is an absolute privilege to be here to talk to you all about our work and the critically important issue that is youth suicide prevention. But before I do that, let me acknowledge the traditional owners of the lands that we're all gathered on here this evening, the Wiradjuri people, and pay my respects to their elders, past, present, and emerging. I'd like to extend that respect to any Aboriginal and Torres Strait Islander people who are here tonight, and acknowledge that sovereignty of these lands was never ceded, and this always was and always will be Aboriginal land. Thank you again for inviting me to be here with you tonight, and thank you to Annette and Stuart, not just for this invitation, but for all that you do for this community and for suicide prevention more broadly. What an absolute force this is. I actually feel terribly humbled to be standing here before you all tonight, knowing the strength and compassion of the community. I've worked in suicide prevention for a long time,
Yeah,
but
sure.
there's never anything that
just getting the
prepares me for the
branding
feeling
into
that I have when I stand up in front of a community that has been impacted by suicide in the way that you have, and yet refuses to let that define you. Rather, you've defined yourselves by strength, resilience, and the leadership that you've shown. In fact, what you're actually doing is defining suicide prevention nationally and what suicide prevention should look like going forward. This is an inspiration not just to each other, but to the whole country. And we need more communities like this and more community events like this. In preparing for this evening, I've been reflecting on the phrase that people have probably heard, that suicide is everybody's business. And how we make suicide prevention everybody's business when we all feel able to come together and do what we can to prevent suicide, whilst not also making it any single person's responsibility. And again, what I see before me is a community coming together and sharing that responsibility. As I've said, I've worked in suicide prevention for a long time, and I seem to be reaching that point in my career, or maybe that age, where I prefer not to count just exactly how long it is. But I can tell you that it's now over 25 years that I've worked in this area. And of course, as many people who do work in this area, I also bring to my work my own lived and living experience. This isn't something that I talk about publicly a lot, but when I was 18, I also lost somebody who was important to me to suicide. I've for many years navigated the complex mental health system with my daughter, which is complex and mystifying, even for somebody like me that's worked in this field for a long time. And I provide ongoing support to one of my best friends who's been living within a suicidal crisis for several years now. But tonight isn't about me, and it's not about the people that are close to me. It's much more broadly than that. The evening is much broader than that. But over that time, what I will say is I've seen significant changes in the way we approach suicide prevention. And I think the way that we acknowledge and value people's lived and living experience is one of those critical changes that we've seen in recent years, but particularly seen here in Australia, where we're absolute world leaders in that field. The other critical change that I think we've seen is the way we come together and talk openly about suicide and suicide prevention. When I first started out in this work, the word suicide was almost a dirty word. People were afraid to say it out loud, possibly for fear of putting ideas into people's heads, or possibly because of a misplaced sense of shame or embarrassment. But we all know that not talking about suicide is actually a huge part of the problem. If we can't talk openly about suicide as a community, How can we talk about suicide prevention?
When you're ready, Kofi.
How can we be there for the people who need us? And how can we reach out in those times of crisis when we need help ourselves? And this is why the work that you're all doing as a community is so important. Because what I see here is a community that can talk openly about suicide, and therefore a community that can be there to support each other in times of need. But at the same time, suicide prevention should not be solely the responsibility of communities. If we follow the philosophy that suicide prevention is everybody's business, then we need suicide prevention activities to be happening at every level and in all the settings that we all live, work, and play. My work, as you've heard, is in youth suicide prevention, and we have a large programme of work that tries to reflect that. We have work that's focused in clinical settings, notably in emergency departments, which are often the first port of call for people in crisis. Yet despite that, we know that many people, when presenting to an emergency department with suicide risk or self-harm, don't always get the good quality, compassionate care that they need, especially now with the impact that the pandemic has had on our healthcare services and, of course, on our own mental health. Our work is trying to change this. We're working with emergency department staff, with young people and families, and policymakers to try to improve the responses that people get when they do present to emergency departments, to make sure that no one is treated badly when they present for help, and to make sure that no one is turned away without getting the help or care that they need. We also have work going on in school settings. Here, that work is focused on building capacity and equipping young people to help themselves and their friends by delivering suicide prevention training to thousands of secondary school students across North and West Melbourne. In evaluating that training, we're also able to identify students who are at risk of suicide but have not previously felt able to come forward and seek help. And we can then link them in with appropriate care. But because we know that the burden of responsibility can't just be placed on young people, we're also providing education and training to school staff and parents. So a really holistic approach trying to prevent suicide across our region and across our community. And as you've heard, we've also got work going on in the thorny space of social media. Now, I probably don't need to tell you that young people spend a lot of time on social media. And that can provide a really important environment for young people to seek help and to help each other. But we know there are also harms, and we've probably all heard stories of young people being exposed to harmful content online, including content relating to suicide and self-harm. So we wanted to find an approach that could capitalise on the acceptability and accessibility of social media platforms, whilst at the same time minimising those risks. And this is how the ChatSafe project was born. The ChatSafe project saw the development of the world's first guidelines designed to help young people communicate safely online about suicide. I think an important part of this project for me is that when we first started out, the rhetoric that we were hearing, the dominant narrative, was we shouldn't be talking about suicide on social media. It's harmful. But we all know that shutting down conversations about suicide isn't the solution. What we needed to do was help equip young people to have those conversations, but have them safely. And the guidelines have been a huge success. They've been downloaded tens of thousands of times. And thanks to funding from the social media industry, from Facebook, they've now also been translated into multiple languages. But because we know that young people are unlikely to read long sets of guidelines, however innovative we think they might be, we then worked in partnership with young people from across the country to co-design a national social media campaign to help make the content of those guidelines more accessible to young people. We took the knowledge and we took the education and we took the suicide prevention activities to young people. We met them where they were at. The guidelines also now sit on the Facebook and Instagram safety centres and hopefully are helping young people worldwide keep themselves safer online. But again, the onus should not just be on young people to keep themselves safe. Policymakers and the social media industry also have some key responsibilities here. And we're now working with both of those groups on an ongoing basis to help improve online safety when it comes to suicide prevention. So as you can hear, we've got a big body of work going on, and I've got a fantastic team of smart researchers, all of whom have dedicated their careers and bring their own lived experience to helping prevent youth suicide. But importantly, we don't work alone. All of our work represents partnerships with our clinical colleagues and service providers, with educators, with the social media industry, with policymakers, and critically, with young people, their families, and their communities. And these partnerships, especially with young people, are key, I think. Tragically, and I don't need to tell you this, that despite all the work that's going on, despite the attention and investment from governments over the past decade, suicides in young people are increasing. So it's not enough for us to keep doing the same and expect change. We need to do things differently. We need to be bold if we want to make a difference. And in doing things differently, we need to listen to what young people want, to what they think will help. And this is where, although suicide prevention may be everybody's business, we don't want to let the government off the hook. So next month at Origin, we'll be releasing a new policy brief to the new government, and this will call for a youth-specific suicide prevention plan that is co-designed and co-developed and co-delivered with young people as real partners. And if we don't do that, our efforts will be in vain, with tragic consequences. We also need our approaches to be inclusive of those people whose voices may not always be heard, yet who are overrepresented in the suicides in our country. If this is everyone's business, we must not leave anyone behind. Nothing is perfect, but we're almost always stronger together. As well as leading the suicide prevention work at Origin, I'm also very involved in the International Association for Suicide Prevention, which is the international peak body for suicide prevention. And each year on September the 10th, they host World Suicide Prevention Day. And the theme for World Suicide Prevention Day is creating hope through action and being the light. The idea being that we can all create hope through our actions, however small those actions may be. We can be the hope, and we can be the light for others who may have lost hope and may be stumbling around in the darkness. Our efforts don't need to be grand. Sometimes just small acts of hope can give hope and light to others. And tonight, on the longest night of the year, you are all being the light and the hope, not just for your community, but as I said at the very beginning, for our whole nation. We need more nights like tonight and more communities like you. I've talked a bit about the work that I do, and that work involves a lot of traveling, lots of talking to people like policymakers, media folks, and even the odd member of the royal family. But there is genuinely nothing I like more about my job than talking to the young people, the families, and the communities who we all do our work for. So once again, let me thank you all for having me here tonight and for allowing me to be part of what is such a special event. Thank you all.